Dear learner, welcome to Module 3, Learning Objective 6.3. In this presentation, you will learn about a minority group, such as people with intellectual disabilities. Let me give you a quick overview of what to expect next. We will begin by giving you an introduction to the topic, what intellectual disability is, and how it relates to dementia. Then, we will continue by explaining the 3 criteria for an intellectual disability. After that, we will follow up with the causes, symptoms, and examples of intellectual disabilities. After this presentation, you will take part in a practical activity, and after that, a knowledge assessment to make sure you digested all of this exciting information. Now, let's get started. Let's start with an overview about intellectual disabilities. Intellectual disability is a term used when a person has certain limitations in cognitive functioning and skills, including communication, social, and self-care skills. These limitations can cause a child to develop and learn more slowly or differently than a typically developing child. Intellectual disability is the most common developmental disability, and it can happen any time before a child turns 18 years old, even before birth. People with intellectual disability are at higher risk of dementia than the general population. For example, Down syndrome carries a higher risk of dementia, and specifically Alzheimer's disease, with younger onset. People with intellectual disabilities are also vulnerable to multiple long-term conditions, also known as multimorbidities. Criteria for intellectual disability. Intellectual disability has 3 criteria. Number 1. IQ is below 70 to 75. Number 2. There are significant limitations in 2 or more adaptive areas, which are skills that are needed to live, work, and play a part in the community, such as communication or self-care. Number 3. The condition manifests itself before the age of 18. Causes of intellectual disability. Sometimes the main cause of an intellectual disability can remain unknown. However, there are some causes of intellectual disabilities that we are aware of. Genetics are the main known cause of intellectual disabilities in many adults. Other circumstances that lead to intellectual disabilities are stroke, head or brain injury, illnesses that negatively affect the brain, exposure to chemicals or toxins that harm the brain, labor difficulties or birth trauma, infections such as meningitis, or malnutrition. As you can see, different reasons can cause someone to develop an intellectual disability, and because of that, it can be hard to determine the reason for any one disability. Symptoms of intellectual disability. Here are the signs you should look for if you suspect one may have an intellectual disability. Slow learning development. Failure to meet milestones in the development. Difficulty reading or speaking. Failing to understand social cues. Issues remembering or recalling things. Inability to perform routine tasks, such as dressing oneself or using a remote. More examples coming in the next slide. Here are more signs you should look for if you suspect one may have an intellectual disability. Relying on nonverbal communication. Difficulty regulating or expressing emotions. Unable to problem solve or think logically. Disordered logic. Lack of curiosity. Inability to understand consequences. And behavior inconsistent with their age. Examples of intellectual disability. Here is a list of potential intellectual and/or developmental disabilities: ADHD, Apert syndrome, autism, cerebral palsy, developmental delay, developmental hearing loss, Down syndrome, and fetal alcohol spectrum disorder. Ethnicity and intellectual disability. Some studies found that people from ethnic minority backgrounds may have different mental health problems, but they are less likely to receive a diagnosis because they reach healthcare services at a later stage of their condition. It is known that ethnicity influences dementia's cause, prognosis, and treatment, while culture shapes help seeking and care. As of this moment, you have reached the end of this presentation. The next step will be to take part in a practical activity where you have to search and write about different intellectual disabilities that can occur along with dementia and what factors need to be taken into account when dealing with such a patient. After completing the practical activity, you will take a knowledge assessment about the intellectual disability minority group topic to make sure you digested all of this exciting information. After completing the intellectual disability minority group assessment, you will take a self-assessment test based on this entire learning objective, including all of the 2 topics you have learned so far, which are caring for people with multimorbidity and intellectual disabilities minority group. Good luck!